Hi everyone. Now we are going to discuss about stroke. First, introduction. A stroke, which is also called a cerebrovascular accident, happens when blood flow to the part of the brain is suddenly disrupted, causing brain cells to be damaged or die. Because the brain controls movement, speech, and many body functions, a stroke can have serious and lasting effects. The next we are going to discuss about the definition of stroke. A stroke is a sudden neurological deficit caused by an interruption of blood supply to the brain, either due to blockage of your blood vessel, which is also called as ischemic stroke, or rupture of your blood vessel, which is also called as hemorrhagic stroke, leading to damage or death of brain cells. Stroke is also considered as a medical emergency in which blood flow to the part of the brain is stopped or reduced, causing brain tissue damage and loss of brain function. The next we are going to discuss about the incidence of stroke. Stroke is considered as the leading causes of death and disability worldwide. The global incidence is about 12 to 15 million people experience a stroke each year worldwide. Around 5 to 6 million deaths occur due to stroke annually. Nearly 50% of stroke survivors may have long-term disability. Ischemic stroke accounts for about 85% of all strokes and hemorrhagic stroke accounts for about 50% of cases. The next we are going to discuss about the age and gender distribution. Risk increases with age, especially after 55 years. Men have a slightly higher incidence than women, but women may have higher disability and mortality after stroke. The incidence in India, stroke incidence in India is approximately 100 to 150 cases per 1 lakh population per year. It is becoming more common in younger adults due to lifestyle related risk factors. Stroke is a major cause of hospitalization, disability, and mortality. And now we are going to discuss about the risk factors of stroke. First one is modifiable risk factors which can be controlled. First thing is hypertension. Hypertension, which means high blood pressure in the blood vessels. It is the most important risk factors for stroke. It can damage blood vessels and increase risk of blockage or rupture. The second thing is diabetes mellitus, which means high blood sugar in the blood vessels can damage the blood vessel over time. And the third one is cholesterol, high cholesterol, which leads to the buildup of fat deposition in the blood vessels, which is also called as atherosclerosis in blood vessels. And the fourth thing is smoking. The smoking can damages blood vessels and increases blood clot formation. And the next one is heart diseases, which means arterial fibrillation, heart failure, and valve disorders can cause blood clots. And the next one is obesity, which means higher weight increases high risk of hypertension, diabetes, and heart disease. The next we are going to discuss about the non-modifiable risk factors which cannot be changed. In non-modifiable risk factors, age, which is above 50 years, 55 years, and the second thing is gender. Men have slightly higher risk, but women may have more severe outcomes. The next thing is family history. Family history of stroke increases risk, and the previous history of TIA, which means a past stroke or mini stroke, increases future risk. The past stroke or mini stroke is considered as a warning sign because it can cause many complications in future period. The next we are going to discuss about the causes of stroke. Stroke occurs when the blood supply to the brain is interrupted or reduced, leading to brain cell damage. The causes depends on the type of stroke. First one is ischemic stroke, which is caused by blockage. It is the most common cause. It occurs when a blood vessel supplying the brain becomes blocked. The other causes are thrombosis, embolism, atherosclerosis, small vessel disease. In thrombosis, formation of blood clot in a brain artery; embolism, a clot formed elsewhere, often the heart, travels to the brain; atherosclerosis, narrowing of arteries due to fatty plaque buildup; Small vessel disease, blockage of small arteries in the brain. The next one is hemorrhagic stroke, which is caused by bleeding, occurs when a blood vessel in the brain ruptures and bleeds. The causes of hemorrhagic stroke are hypertension, which means high blood pressure. It is the most common cause. Aneurysm, weak, bulging blood vessels that can burst. Arteriovenous malformation, abnormal blood vessel connections, head injury or trauma, blood clotting disorders, or anticoagulant use. Next thing is transient ischemic attack, which means mini stroke. It is a temporary blockage of blood flow to the brain that resolves quickly. The causes are temporary blood clot, narrowed blood vessels, which is also known as atherosclerosis. The next we are going to discuss about the clinical features of stroke. The motor symptoms are sudden weakness or paralysis in the face, arm or legs, usually on one side of the body. Hemiplegia, which means complete paralysis in one side. Hemiparesis, which means partial weakness on one side, difficulty in walking or loss of balance and coordinations. The sensory symptoms, which includes numbness or loss of sensation on one side of the body, tingling or abnormal sensation. And the next thing is by speech and language disturbances, aphasia, difficulty in speaking or understanding speech. Dysarthria, which means slurred or uncleared speech. The visual disturbances, which includes blurred vision, double vision, sudden loss of vision in one or both eyes. Cognitive and mental changes in stroke are sudden confusion, memory problems, difficulty in understanding or concentrating, the headache and altered consciousness, which causes sudden severe headache, more common in hemorrhagic shock, dizziness or vertigo, loss of consciousness or coma in severe cases. The fast warning sign of a stroke, which includes F for facial drooping, A for arm weakness, S for speech difficulty, and the T for time to seek for emergency help. These are the warning signs of stroke. Next, we are going to discuss about the diagnosis. The diagnosis, which includes blood test, CT scan, MRI scan, carotid Doppler or Doppler sonography, ECG, echo and EEG. The next we are going to discuss about the management of stroke. The management of stroke focus on restoring blood flow, preventing further brain damage and rehabilitation. Early treatment is essential to prove an outcomes. Emergency management, which means initial care, are assess airway, breathing and circulation, provide oxygen if needed, monitor vital signs which includes BP, pulse and respiratory rate, establish IV access, check blood glucose and correct abnormalities, perform urgent CT scan or MRI to determine the type of stroke. The medical management of ischemic stroke, which means blockage in the blood vessels, which includes thrombolytic therapy given within 4 to 5 hours of symptoms onset to dissolve the clot. The second one is antiplatelet drug, which includes aspirin to prevent further clotting. The next thing is anticoagulants in selected patients. The next one is control blood pressure, blood sugar and cholesterol in the body. In hemorrhagic stroke, control blood pressure, stop or reverse anticoagulant medications is applicable, manage intracranial pressure, surgical intervention may be needed, evacuation of hematoma, repair of aneurysm or AVM. Prevention of recurrence, control risk factors like hypertension, diabetes, high cholesterol, stop smoking and limit alcohol, healthy diet and regular exercise, long-term medications are prescribed. Thank you.